My name is Nicole here with another question drill set. If you are new here and don't know how a question drill set works, well, welcome in. Glad to have you. Glad you stumbled upon us. A question drill set is something that we do every week, multiple times a week, to get you in a better rhythm and a better practice at how to answer these NCLEX style questions so you're better prepared to take your NCLEX test when the time comes. So today's topic is GU, everything GU related, whether it's catheters, whether it's bladder, kidney infection, everything in the GU system. I will pull up a question here right next to me, give you about 30 seconds to review it, try to figure out what the right answer is, and drop it down in the chat, whether you're on Instagram, TikTok, YouTube, all of it. I have the chat here pulled up next to me, and then we go over why the right answers are right and the wrong answers are wrong. We have Nurse Samantha in the chat moderating for me today. So if I miss something or I go too fast, or if you need reiteration, I can maybe explain after reading it, or Samantha can go over some information that you guys may need. And I just like to talk and be a little community in the chat. So don't be shy, don't be afraid. Drop your answers, comments, all my little answers to questions that I might ask in the chat, and let's just be friends. Okay, let's get started. First question. The nurse is caring for assigned clients. The nurse should first assess the client who has what? Option 1, nephrolithiasis and hematuria. Option 2, acute kidney injury and an elevated serum potassium level. Option 3, a urinary tract infection and pyuria. And option 4, chronic kidney disease and decreased glomerular filtration rate. Ooh, that was a hard word to say, but go ahead and drop what you think the answer to this question would be in the chat, and we'll go from there. Also, shameless plug, we hit our 75,000 subscriber little goal that we had, which is so great, so great. Thank you guys so much for sharing and following us on all social media platforms. Now our next goal is to reach 100,000 by the end of the year. So share it to all your nursing school friends, all your nursing school classmates, whether they're already nurses or about to be nurses, like in nursing school with you. Share it to everybody who just needs some reiteration and to stay in the know with nursing topics and random little questions. See if your other nursing friends or friends that are already nurses can still get these questions right. So I feel like I learn every single time I start reviewing these question drill sets and preparing for them. So it's always a good little question thing to kind of challenge yourself. Okay, we're starting off strong with the answer choice for this question. Pretty much everyone got it right. It is option 2, acute kidney injury and elevated serum potassium level. So with this question, we're looking for the the client that we should assess first, meaning if we don't do an intervention or do something quickly, then it can very quickly turn into a complication. So expected findings versus complication. So option 2 is the only one that is technically a complication. Acute kidney injury and elevated serum potassium level. So yes, we know with acute kidney injury, your electrolytes get out of whack and a little out of balance. So with the serum elevated potassium level, we know potassium very quickly can cause heart arrhythmias and cardiac problems. So we need to treat the elevated potassium level very quickly so we don't run into more problems. So this is a complication of acute kidney injury that needs to be assessed and corrected so more complications don't happen. Option 1, 3, and 4 are all expected findings that could probably come with the disease process. Nephrolithiasis or kidney stones and hematuria, which is blood in the urine from that kidney stone either blocking or causing some irritation in the ureter or the urinary tract system. Option 3, a urinary tract infection and pyuria, pain and some discoloration and maybe pus in your urine. And option 4, chronic kidney disease and decreased we're going to skip that word, filtration rate. This is how we actually assess chronic kidney disease. Once you get to a certain point, you unfortunately go up. So you start from acute kidney injury to chronic kidney disease to end-stage renal. And that glomerular filtration rate, or the GFR, is the main indicator that sets you apart from each different stage. So a decreased glomerular filtration rate, or GFR, is associated with chronic kidney disease. But you guys got that one very, very easy. Good job, guys. Question 2. The nurse is observing a staff member caring for a client who has an indwelling urinary catheter. The nurse should intervene if the staff member is observed doing what? Option 1, emptying the urinary drainage bag twice during the shift. Option 2, cleansing the client's perineum with soap and water after a bowel movement. Option 3, securing the catheter to the client's upper inner thigh. And option 4, maintaining the urinary drainage bag above the client's waist when assisting with ambulation. Let me know in the chat what you guys think on this question. Good job. Someone in the chat, Miss Vat on TikTok, said she just passed her NCLEX. Good job. Congratulations. Welcome to the RN world. Glad you're still staying tuned and keeping up with your nursing information. Good job. People are saying this one is too easy. And I can't say I agree, but I'm starting you off pretty mellow. It's only going to get harder. Just kidding. From here. But if you guys were tuned into our NSNA webinar that we held on Monday, another key feature thing that we said is sometimes when you're taking your NCLEX, if you feel like your NCLEX is getting harder and harder and the questions are getting harder and harder, that actually might mean that you are doing very, very well because you are getting the questions right. If things are starting to get a little too easy, that means you're getting might not be passing or selecting the correct answers. So the NCLEX is actually trying to help you by challenging you in your specific way. So if it's getting harder, that means you're doing well. So for this one to be easy, that means I'm going to get harder on the next one. So correct answer for this one is option 4, maintaining the urinary drainage bag above the client's waist when assisting with ambulation. So going back to the question, we're looking for something to intervene, meaning we're looking for an incorrect intervention or incorrect action that the nurse would be doing. So if they are maintaining that urinary drainage bag above the client's waist when ambulating or when walking, this would be something we don't want them to do. Having that urinary drainage bag above the waist can create that backflow of urine back into their bladder system and cause UTI and infection. And again, that would be another complication that we could have not had in the first place if we just had it below. Let gravity help in their favor by keeping it below and having the urine drain away from them. Options 1, 2, and 3 are all correct interventions and things that we want to do. We want to empty the urinary drainage bag at least twice during the shift. I always recommend maybe even emptying it earlier, especially if they're on a diuretic or something. You always want to empty the bag when it's 2/3 to half full, but at least twice during the shift. Option 2, cleansing the client's perineum with soap and water after a bowel movement. This ensures that the perineum area is very, very clean by being very thorough and cleaning away from the catheter so no bacteria gets on the tubing and that could go back into the bladder. And option 3, securing the catheter to the client's upper and inner thigh. This is a correct teaching, something that we do to kind of anchor the catheter in place so it doesn't cause tension on the balloon or tension on the catheter itself and go flying and swinging everywhere. So yes, secure the catheter to the client's upper bag, but do not maintain the urinary drainage bag above the waist. But you got it. Easy. Good job. Let's see if I can get a little harder for you guys. The nurse is caring for a client with urge incontinence. It would require follow-up if the nurse does what? Option 1, teach the client pelvic floor exercises. Option 2, provide the client with a toileting schedule. Option 3, encourages the client to avoid caffeinated beverages. And option 4, instructs the client to empty the bladder every time the urge to void occurs. Let me know what you guys think for this question in the chat. Someone is saying, congrats, Victoria. I missed it, but congrats, Victoria. I'm guessing you passed your NCLEX. If there are any other new NCLEX passers, or if you scheduled to take your NCLEX, drop it down in the chat. I would love to wish you the best of luck or congratulations and get you feeling good, feeling right. So drop your NCLEX down in the chat. So when Miss Janine took hers July 14th and passed an 85. Congratulations. Congrats. Welcome to the RN world. Who else? Who else? Who else? Someone is taking theirs in August. Someone is preparing for the test, which is all good things to hear. Thank you guys for tuning in and getting some resources to take your NCLEX. Miss Barbie Anna is taking hers in a week. Good luck to you. We got some rationales in it. Good. Zaina on Instagram took hers July 9th. Congratulations, and she passed. Congratulations. We have a couple of people that are studying for theirs. Someone just passed their LVN. That is amazing. Good job to you. And a good amount of people are still studying, which is great. Good luck. Thanks for tuning in and getting a study session in. So let's move on to the correct answer, which would be option 4. Instructs the client to empty the bladder every time the urge to void occurs. I saw someone in the chat that also talked about every time, or using when the answer choices uses absolutes like every time or only. Those are usually the answers that we steer away from unless it's an absolute fact 100% of the time, which sometimes there are a little, those naysayers, that 1%, that 0.1%. But if it's an absolute fact, like the main thing that I always think of is stop smoking. That is always going to be a fact and always going to be a good teaching point for someone. So anytime it has an absolute for every time and only, those are answer choices that we kind of want to avoid. So in this case, instructs the client to empty the bladder every time the urge to void occurs. This again would be an incorrect teaching point that we want or wouldn't want to give the client. Especially with urge incontinence, they are going to have that urge frequently. That's the whole point with the urge incontinence. They kind of dribble a lot, or they always have that sensation that they want to go to the bathroom. And sometimes they have that incomplete bladder emptying because that urge is happening so often because that bladder muscle is just being spasmodic. So in order to prevent this, we put them on a toileting schedule, which is option 2, to kind of help retrain the bladder so the client can go on demand whenever they want the bladder to go. Not that urgency every few minutes. We want to retrain the bladder. Option 1, teach a client pelvic floor exercises. Again, this is going to be a correct teaching point, and this goes with teaching that bladder to go on their demand and not on that involuntary urge demand. And then option 3, encourage the client to avoid caffeinated beverages. Again, a correct answer, because caffeinated beverages also can act as a diuretic, and the diuretic can act and increase the urge to go to the bathroom. So we don't want to encourage or have them drink caffeinated beverages because we don't want them to go to the bathroom so much, because we're trying to retrain the bladder. So everything with urge incontinence goes to retraining that bladder, trying to space out how often they go to the bathroom so that they can go on their demand and not that urgency demand. But you guys did very good. I feel like I'm still giving y'all good, easy questions, but let's see if this one can kind of trip you up. Question 4, the nurse is assessing a client with pyelonephritis. Which of the following findings would be consistent with the condition? Select all that apply. Option 1, fever. Option 2, dysuria. Option 3, nausea. Option 4, flank pain. And option 5, periorbital edema. Let me know what you guys think in the chat. And congratulations to Nick. I missed it, but I'm guessing you passed your NCLEX, so congratulations, Nick. You're getting a lot of love in the chat, which is always nice to see. Good job. Good job, good job, good job. Lots of correct answers for this one. This one is a basic knowledge and understanding type question. What are the symptoms of pyelonephritis? Good job, guys. Seeing lots of 1, 2s, 3s, and 4s. Good job. If you want to have more question drills or be a part of question drills or lectures, visit us at uworldnursing.com so you can see our full event schedule for the next couple of weeks to know when to tune in if we're going to be covering one of your favorite topics coming up here shortly. And then we also just have fun things like question of the day, question of the week to kind of challenge you specifically. So check us out at uworldnursing.com. I think majority of everybody got it right or got a good variation of this select all that apply right, which is options 1, 2, 3, and 4. So again, this is a basic knowledge and understanding of what pyelonephritis is, which is a kidney infection, usually derived from a bladder infection that has gone up the urinary tract and into the kidneys. So a kidney infection, and that is shown with fever, dysuria, nausea, and flank pain. One thing with select all that apply that's very helpful nowadays with the NCLEX testing is if you got majority of these right, you would get that partial credit. If one of them was off, it's not going to hurt you that you got one or you missed one of the correct answers, or if you select a wrong answer, it's also not going to hurt you. So select all that apply. This is just your hint that you shouldn't be afraid of select all that apply because it can only benefit you because it's only going to add to your score. It won't take away from your score. So y'all did great on that one. So when asked what pyelonephritis is, again, that is a kidney infection that has derived from a bladder infection. So good job. Let's go to question number 5. The nurse is providing discharge teaching for a client with benign prostatic hyperplasia. Which of the following statements by the client would require follow-up? Option 1, voiding every 2 to 3 hours promotes bladder emptying. Option 2, the condition increases your risk for bladder infections. Option 3, decreasing caffeine intake can help alleviate symptoms. And option 4, limiting your daily fluid intake helps prevent incontinence. Let me know what you think in the chat. Which one would require follow-up? Drop your answers down in the chat. Let me know. And since we are well past halfway through, you can also drop in the chat where you guys are tuning in from. I love to see how far UWorld reaches in the whole world. And I like to compare morning to the afternoon, which one's more international viewers versus domestic viewers. So let's see, my first person that I see is Houston on TikTok, Ghana, Washington State, Ontario, Canada, Toronto, Maryland, Cameroon, Palm Springs, California. Someone is saying looking for follow-up, so the wrong statement. That is correct. Ghana, Arizona, Illinois, Jamaica, Illinois, Uganda, Vegas, Sacramento, New Jersey, Kenya, Georgia, Miami, Kansas City, California, Kenya, San Antonio, Texas, Sacramento, unfortunately, hopefully not unfortunately, North Carolina, Brooklyn, New York, Mississippi, Baltimore, Cameroon, UK, tuning in from Gambia, hello, Uganda, South Africa, Pakistan, Maryland, Minnesota, Ghana, Kenya. Got a lot of African countries here. I love to see it. Kenya, Nigeria, Ghana, Houston, which sometimes I believe is Africa here in the United States. Nepal, Alabama, Haiti, Turkey, Zambia, Finland, Kuwait, Jamaica. Well, hello. We have a lot of international people. So I feel like the afternoon time is my international peeps, and then my morning time is my domestic friends. So nice. Okay, correct answer. Like someone says, we are looking for a question or an answer choice that requires follow-up, meaning it's a wrong statement, a wrong intervention. So with this one, limiting your daily fluid intake helps prevent incontinence. This would be something that we wouldn't want to teach our client with benign prostatic hyperplasia. And what this BPH is when that prostate enlarges, which can kind of compress that ureter and have them have a difficulty urinating and have incomplete bladder emptying. So a lot of this BPH teaching would also correlate with the things that we teach the urge incontinence. So limiting your daily fluid intake helps prevent incontinence. This is wrong. We actually want to encourage fluid uptake or intake so that it can flush that bladder out, so that bladder doesn't have that urine sitting in it, which can harbor bacteria and cause that urinary tract infection. So you want to have them drink a lot of water and a lot of fluids to help flush that bladder out and have them have the complete emptying with that full feeling sensation that they would have. That's the correct way to say it. Options 1, 2, and 3 are correct teaching points. We want to teach them to void every 2 to 3 hours, which promotes that bladder emptying. Again, this is just like urge incontinence. We want to put them on that toileting schedule so they can urinate on their demand and not off of that urgency that sometimes that they feel, and that can also lead to incomplete bladder emptying. Option 2, the condition increases your risk for bladder infections. So like I said, with that incomplete bladder emptying, that urine can stay in the bladder for a little bit longer and harbor bacteria and cause UTIs and bladder infections. So we increase their fluids, and then they will have a whole bunch of fluids flush through the bladder to help alleviate all that bacteria. So it does increase the risk for bladder infection, but if they're on a high fluid intake, which is what we want them to be, they will have a lower risk, but they're still at risk for bladder infections. Option 3, decreasing caffeine intake can help alleviate the symptoms. Like I said before, that caffeine can be a diuretic, which can have them go to the bathroom a lot more, which is something that they don't want to do unless they're on the toileting schedule, which is usually spaced out, and hopefully decreasing that urge as well. So decreasing that caffeine intake will help them decrease the need for them to go to the bathroom so often unless they want to go to the bathroom. So very good. Next question. The nurse is assessing a client who had an arteriovenous fistula created in the right forearm 3 days ago. Which of the following findings would require immediate follow-up? Option 1, pain at the fistula site rated as a 4 on a scale of 0 to 10. Option 2, whooshing sound auscultated over the fistula. Option 3, 1+ radial pulse in the right arm. And option 4, 2+ edema of the right arm. Let me know what you guys think in the chat. So, and also from Lebanon and Dubai. Fun places. Someone asked, how do we subscribe for UWorld? You can go to uworldnursing.com where we have multiple subscription packages. But then we also have our free sessions that are here every Tuesday, Wednesday, Thursday, Friday, and Sunday on all social media platforms. So lots of ways for you to get plugged in and get lots of NCLEX teaching. Good answers. Oh, but now the answer choices are varying. I'm seeing 3, 4s, and 2s. Look back at the question, and we're looking for something that would require immediate follow-up. So we're looking for a complication. So go through each answer choice and see, is this an expected finding for someone who had a fistula only 3 days ago? Or is this a complication of a fistula coming? Expected versus complication. And we have some good rationales in the chat. Love that. Love when you guys put rationales. It also helps other people see some rationales as well. Someone is asking, is swelling a complication? Question mark, question mark. Good job, guys. Yep, someone said, think of your ABCs. Cough, cough. This is true. But we're still going back, I guess, between options 3 and 4. Good job. Correct answer would be option 3, 1+ radial run plus radial pulse in the right arm. So that AV fistula, which you guys pretty much already know and from the rationales, but that is when we combine the artery with the vein to create a new blood vessel that is able to be penetrated for dialysis. So we can dialyze them with the oxygenated blood and with the electrolytes that they need. Just an access site for them. So with this, this client has received this 3 days ago, meaning this is fresh. So they are expected to have pain in the site, especially as it matures. It takes a couple months for this to be to fully mature and to be able to be used. So pain at the fistula site rated on as a 4 on a scale of 0 to 100. It's not extreme pain. It's just pain at the site. Pain is one of our highest priorities. You always think of our ABCs first. So again, yes, this would not be our priority patient to do the immediate follow-up. Option 2, whooshing sound auscultated over the fistula. This is something that we want to hear. You want to hear the whooshing sound, which is the bruit, and you want to feel the thrill of it, which is lightly tapping it, and you can feel the blood circulating and the arterial blood and the venous blood mixing together. So you want to, those are normal findings to have. And it gets accentuated the longer that this, the longer that this fistula is maturing, the harder the thrill and the bruit will be felt and heard. Option 4 is incorrect, incorrect because it is an expected finding to see some swelling in that right arm. This fistula was just made only 2 days ago, so it is expected to have some edema around the site. This is a major surgery. Creating an artery and a venous is a major thing. So having swelling on that right arm is expected. But option 3, 1 plus radial pulse in that right arm. With a AV fistula, you want to have full bounding or at least normal full bounding circulation or pulses felt distally from the fistula. It still should be intact, so that 1 plus would be considered weak and thready, which is something that we don't want. This means that there might be a complication of a thrombus or something occluding that circulation, which would be the C and ABCs. So we need to do immediate intervention to maybe assess why we're having a weak and thready pulse, so we can intervene and correct the circulation and get that regular pulse or that full bounding pulse that we usually see with these AV fistulas. So that is why option 3 is wrong. We need to intervene and get that pulse back to normal. Last question of the day. The nurse is caring for a client who had a transurethral resection of the prostate 8 hours ago and is receiving continuous bladder irrigation. The urine in the drainage bag is dark red and viscous. Which of the following actions would be a priority for the nurse to take? Option 1, document the findings. Option 2, increase the irrigation flow rate. Option 3, remove the indwelling urinary catheter. And option 4, use sterile water to manually irrigate the indwelling urinary catheter. Let me know what you guys think in the chat. And we'll go from there. Good job, good job. Seems like you guys know a TURP intervention very well. Let's finish strong. Yeah, let's finish strong. Also, let me know how many questions out of 7 you guys got right today, even after this one. How many questions you got right? Was this too easy for y'all? Do I need to get a little harder with my question drills? And I'm seeing some good rationales as well, which is always good to see. Good job, guys. Good job, good job. This one's pretty unanimous. Not everyone, but most people got it right. Option 2, increase that irrigation flow rate. This is something that we would want to do first when we're seeing a TURP client having dark red and viscous output. So that continuous bladder irrigation is going, which is a triple lumen catheter, where we're having those huge bags of saline poured into the client's bladder to kind of filter it and flush everything out, all those blood clots, to kind of create a nice new smooth bladder lining and your ureter tract. So increasing that irrigation flow will make that output light pink to clear. The doctor will usually put an order to kind of titrate that irrigation flow until it is that consistency for a significant amount of time. If we're seeing that dark red and viscous output, that means that our irrigation flow is too slow, or maybe there is an occlusion of some sort that is blocking the flow out, and it's causing more blood clots or more obstruction than is actually being put out. So we need to assess, and then increase that irrigation flow to kind of filter everything out and make sure the doctor will be happy with our output. Option 1, document the findings. This is something that, yes, we would do, but it's not priority because that dark red and viscous is actually showing us that we have a little bit of a complication that we need to attend to. So we're going to do a little bit more than document the findings. Option 3, remove the indwelling urinary catheter. This would be the exact opposite thing of what we want to do, and the doctor would be very, very angry and mad that we did this. You want to keep that indwelling urinary catheter in place until that dark red and viscous is light pink or clear. So this would be the exact wrong time to be taking that indwelling urinary catheter, and can cause more problems later on. And then option 4, use sterile water to manually irrigate the indwelling urinary catheter. This is something that we could do if we have a doctor's order. And this is if our option 2, increasing that irrigation flow rate, does not work. So we can irrigate it. Maybe that blood clot is occluding the opening of the catheter to actually have the output. So you could irrigate it to kind of push that blood clot out and off. But normally, first thing that we would do is try to increase that irrigation flow rate, because this is something that is in the nursing scope of practice. While option 4 is something that we would actually need to get an order from the doctor. And this is actually probably step number 2, not the first priority thing to do. But you guys did pretty good. A lot of people are saying 7 out of 7. That means it was a little too easy. I'll go harder on you guys next week. Lots of 7 out of 7, 5 out of 7. Regardless how many questions you guys got right, thank you guys so much for tuning in. I hope you learned something new. And if not, we got some more strategies and more tips that we can teach you until you take your NCLEX, and just to have on hand for nursing information in general. So I will see you guys next week with a harder question drill. Thank you guys. See you next time.